Right. Good evening, everybody. Good evening. Good evening. Good evening. Good evening. Good evening. Thank you for joining us. We're going to get started in just a few seconds. Thank you for joining us. We're going to recap today's city council meeting and, of course, give you the latest on COVID-19. Thank you, everyone, for joining us. Just give us a few more moments. Hello, hello. Good evening to everybody. Good evening. Good evening. Thank you, everybody, for joining us. Hope everyone had a wonderful Easter holiday. Ate some good food at home, self-prepared in a safe way. Thank you for that. That is. Get it off though. Thank you. Thank you. Thank you. We're going to get started in just 45 seconds, everybody. So just give us another 45 seconds and we will get started. Thank you, everyone who's joined us tonight. Right. Good evening. Good evening. All right. Thank you, everybody, and welcome to another Brandon's briefing. Tonight, we're going to brief you not just on COVID-19, but we just finished our second digital city council meeting, so we're going to update you on what was discussed at the city council meeting tonight as well. But wanted to start off by first giving you guys the latest COVID numbers here in Maryland and in Baltimore City. We now have 8,936 cases of COVID-19 in Maryland. There are a total of 262 deaths statewide. The city of Baltimore has 873 confirmed cases and 26 COVID-related deaths as of earlier today. You can always know that this information is available on the website. You can get that broken down by zip code as well as updated each and every day, and by race, which is something that we push for here in the city and is great. And very thankful that the mayor's administration honored our request and was able to put that information out there for us. So tonight, as I said earlier, I am just returning home from City Hall from our latest city council meeting, and wanted to give you guys the update on what I introduced there and what things were discussed. So I introduced 3 resolutions tonight and 1 ordinance to ensure that we're doing everything we can as a city to protect our residents throughout COVID-19. The first one we're going to talk about is an actual ordinance. The difference, just get everyone a sense of reminder. Ordinance is like an official law that when we pass it, it actually goes into the city's law, into the city's code. Resolutions are oftentimes when the city council doesn't have the direct authority to do something. We pass that if it's something that we're asking the state to do or someone else, and we're going to talk about a couple of those tonight as well. So first and foremost, Ordinance 20-0520, false statements of emergency. So we know that there are people in times like these who want to prey on our most vulnerable and anyone when we're all in this most vulnerable time. That's not okay, and we have to do what we have to do to protect folks and get ahead of that. We've already seen, I'm pretty sure you guys have seen on the news and everywhere else about the scams that people are reporting, that people are trying to run on people around COVID-19. We've seen some BGE has sent out things about warning people about scams. We at the city through DPW, we've had both our federal attorney and our Attorney General for Maryland, warning people about the kind of things that people are going to try to scam you out of your money around COVID-19. Be it that something about your water bill, something about your BG&E, them telling you something about your health insurance, or talking about how they can get you masks or get you a ventilator. Be very mindful of that information, and what we're doing with this legislation is to make sure that people who do these things will be punished. This ordinance, when and if it passes, will come with, if someone gets caught doing this in the city of Baltimore, they will face a fine of $500 and up to a year in prison. So we're going to try to push this legislation as quick as humanly possible to make sure that we're able to protect folks throughout this crisis. So that's just the first of many tonight, but wanted to lift that one up because we know people are always trying to plot and scheme, especially when people are vulnerable, and everyone right now is vulnerable in the city of Baltimore. The next is Resolution 20-021R, Emergency Response to COVID-19, Immediate Housing for Persons who are Homeless. We know that our city struggles with homelessness, and we have so many individuals who are homeless, and we need to be willing to understand that COVID-19 is having a deep impact on everything in the city of Baltimore. But when you are literally the most vulnerable, we know that it has a deeper impact on you. And this is a situation, COVID-19 is presenting a situation like we've never seen before. As I've said since the beginning of the year, the council will continue to lead during this tough time and pushing us to do things that are out of the ordinary and some things that we have never considered before. And what I have asked for is for us to tap into the rainy day fund in this case with this resolution that was unanimously supported by the city council to rapidly house our homeless population as quickly as possible to prevent the spread of COVID-19. I know that this is not something that can happen overnight. We know that's not going to happen overnight, but we have to do everything in our power and have a plan that allows us to keep our most vulnerable residents across the board safe. That's how we save lives. That's what we have to do to continue to move forward. The next one was Resolution 20-209R, Inmate Release Due to COVID-19. This resolution was also unanimously passed. We know that the ACLU, our state's attorney, many other folks have sent to Governor Hogan recommendations for releasing, again, let me be clear about this part, releasing non-violent offenders from jail and prison due to the COVID-19 pandemic. We know that Maryland is an emerging hotspot. We know that other states have already done this kind of work, and what we are simply doing is asking the governor to recognize that we have to protect our responders, our public officials who work in these institutions, who are putting themselves at risk, but also implementing public health best practices that will not risk our public safety, but will do the right thing for the state of Maryland. So as of last Wednesday, the Maryland Department of Public Safety and Correction confirmed 57 cases of COVID-19 within our prison system. This resolution calls on the governor to take these steps to release these people from prison immediately. Anyone whose sentence is scheduled to end in the next year, of course, and meeting those qualifications that I laid out earlier about nonviolent, also who is being held on a technical supervision or violation, and who is particularly vulnerable to COVID-19, including people 65 years of age and older, people with the underlying health conditions such as heart disease, chronic lung disease, moderate to severe asthma. This is something that can be done and something that should be done. We should not be keeping folks who are not at risk to our public safety. Again, we're focused on the non-violent offenders that are in prison right now, not the folks that are in there for violence in our city of Baltimore. And this resolution was also unanimously approved by the city council. The next one, and actually the last one that I introduced, which is I think is one that's the most critical, so I want everyone to hear this. It's Resolution 20-0212R, COVID-19 essential businesses and resident activity regulations. We know anyone in our city can clearly see many Baltimoreans are still being put at risk of contracted COVID 19 while conducting essential duties as a result of individuals not practicing social distancing and essential businesses not putting into play social distancing techniques. Whether that be as a worker or a consumer, it's our duty to protect the employees who are risking their lives daily to provide us the services that we need and our residents who need to obtain the things that they need to survive. I introduced this resolution, and what this resolution does is call on Mayor Young to issue a executive order during the state of emergency to require all businesses deemed essential businesses in the city of Baltimore to officially institute social distancing measures in their establishments. So what does that mean? If you go to the grocery store now, you can see that they're only allowing a certain amount of people in the store at a time. You know that they're tracking the flow through the aisles. But think about in Baltimore City when you're thinking about 21215, where I grew up in Park Heights, where people are going to the corner store, in some cases the liquor store, and getting their bread and stuff from there. And these individuals need to be able to practice social distancing as well. And we know that if they start to limit the amount of people in their stores, it will be something that will help keep our citizens safe and healthy. Every store, every business that is open and essential should be putting into practice these kind of things that have been proven to work, not just here in Baltimore, but across the country. The second portion of that, it is a resolution. The resolution also calls for the mayor to add into this, into the executive order, a requirement that residents, when you are off your property, residents, visitors, people who are in Baltimore City, to wear masks, requiring you to wear masks or some sort of facial covering when you're out conducting your essential activity. We know that many Baltimoreans, especially in our most challenged neighborhoods, suffer from pre-existing diseases and conditions and therefore are at high risk of severe illness or death if they are infected. It is our duty to do whatever we can do to protect them. We know that these things are being put in place in other places across the country as well. Our neighbors in D.C. have implemented that. The mayor has said that when folks are coming, they should be out. They should be wearing those masks or covering their face in some way. Knowing all of these factors, it is essential for us to take these proactive measures. We have to do things that are going to be challenging and tough in order for us to protect people and protect ourselves and keep ourselves healthy. We also tonight passed a resolution. Last week, you guys know that I released my COVID-19 policy document, and I talked about in that COVID-19 policy document talking about using city resources like the Children and Youth Fund to help break down the digital divide in Baltimore, making sure that we're able to purchase laptops and tablets for our young people and dealing with food insecurity. Councilman Cohen, along with myself and the other members of the council, Councilman Cohen introduced a resolution that we passed tonight, saying that the city should do that as well. We have to make sure that we're providing for our young people. I'm going to turn and take some questions, and then we have some more information. Thank you for staying with me for just a second there. All right. So I see a question from Miss Christina Flowers. How do I feel about Mary Pat Clark resolution for homeless? So Christina, you should know that was my resolution that we were just talking about if you just joined us here. So it's my resolution, not Mary Pat. I'm glad to have Councilwoman Clark's support on that resolution. So you should follow up with us. We can send you the direct link. So I feel great about the resolution to house the homeless because it was my resolution. All right, so somebody asked a question, why aren't there any supermarkets in Baltimore City? So this is a conversation that is beyond COVID-19. We know that supermarkets have a model, and we know that I actually have proposed on my campaign side that we should be looking at even making sure that we are even the city should be thinking about building supermarkets. We've done a lot in the city government to try to attract supermarkets to places where folks call food desert or healthy food priority areas, giving a tax break to any food market that wants to operate there. But we know that we have to do a lot more tough work to make sure that we can operate more. But where you are, who asked that question, send us a direct message. We'll try to connect you with the closest supermarket to you and see what we can do to help. And yes, if you have questions, please send your questions in. We will make sure that your questions get answered. All right. Someone said, will people be rejailed post-COVID? So again, this is something that's not in the power of the city council. We're asking the governor to follow these recommendations that have been made by folks, not just here locally or in the state, but around the country. We believe that this is the right thing to do, and people that meet that qualification, no, they would not be rejailed under that. All right. Let's see. So someone asked a question, what's the status of the Water Accountability and Equity Act? We actually tonight, you'll find that tonight, tomorrow when we post a new hearing schedule on the City Council's website, and we'll also, as always, send that out on our social media. I introduced a resolution a few meetings ago to request the mayor's office and the Department of Public Works to come to the city council to update us on how they're implementing the Water Accountability and Equity Act. So stay tuned. We're going to be getting the answer to that question. Thank you for that great question. All right, I see some more questions coming in here. What are we doing about providing fresh fruits and vegetables for Baltimore City residents? I work at the Be More Clubhouse, and your members are in need. Oh, thank you. Yes, first of all, shout out to the Be More Clubhouse. It's a wonderful organization that does wonderful work for our citizens. Send us a direct message. We will connect you direct with some services from our agencies who are helping to give out food. So please send us a direct message so we can follow up with you guys, because we know and appreciate the great work that you guys do over at the Be More Clubhouse. Thank you, and thank you for allowing me to come visit before we were all sequestered. Let's see. Someone asked a question. The June 2nd primary will be vote by mail, and say some places will, polling places will. How will that work? The question is, we don't know yet, right? We know that they just made some decisions today about what they're doing for the congressional election tonight at the city council meeting. Councilman Burnett, at the chair of the Legislative Investigations Committee, at my request, also is calling for an oversight hearing where we're going to call in the Board of Elections later this month to talk specifically about how we're going to carry out that election. So stay tuned. We're going to get the information for you as soon as we can have it from the local Board of Elections as well. Great questions. Your questions, where do you send your questions? You can put them right in, you can put them in here. Sometimes, now listen, you can imagine that it takes us some time to get through a lot of the direct messages, because I get a lot of them. So someone will always follow up with you, and I'll make sure that I look for your name when this is over to try to follow up with you directly. Thank you for that. Let's see. Are there any updates on laptops for students? So yes, the school system has been giving out laptops. Actually, I was going to check back with them later tonight about laptops to see where they are, because I know today was a real big day on how they were doing that in the delivery of them and trying to get them out to our young people and our families as quick as possible. So tomorrow, you should check back in, and we might have more of an update. But again, always go to the school system's website. If you know families that you can fill it out for that don't have access to the internet, they are still doing that survey where they're talking about people's food and their digital needs. So please, if you can, just go to BaltimoreCitySchools.org and maybe fill that out for them. They've started to distribute to high schools. Yes, you're right, Miss Hall, and they've been doing that for a while. But I'll get an update for them later tonight and be able to do that. So someone say, if essential workers are going to be required to wear masks, is there a city-based provider for masks because some stores are price gouging? So this is a discussion, a great question for. This is a discussion and think something that I am going to push for as well, to figure out ways for us to, even in some cases, maybe even provide masks as much as possible, and try to, especially for our essential workers, make them available. We've been doing some great work working with our healthcare workers, our frontline workers, and making sure that they're provided with masks as well. So great question, sir. So someone's saying, when will you know something about school? So let me just state this for the record. Thank you for this wonderful question. Uh, the school decision is not even a decision made by our local school leaders. It's going to be made by the state, and we'll see in the coming weeks when that will come. And we're just all going to have to wait. My gut tells me that they're not going back to school, but we don't know that, right? We don't know when they are going to do it, right? We don't know how the governor and the state folks are going to do that. All right. Someone had a question. Uh, this is a trying to see here. I can't see the whole question there. Oh, let's see. I work at a recovery program with women and children. They consistently sell drugs. We call the police. They sit on one side of the street in the dope. Okay. Please, dope dealers on the other side, send us that information in a direct message. We don't want to air your business out here. We want to protect you. So please send us a direct message for that. So someone says, do we have to stay home for 18 months? And is the public will the public be open as of next month? So the answer to that is we don't know, right? As I always say each and every day, everything that we do will be based on the advice of public health professionals. Every decision that I make is based on the advice of public health professionals. For example, this wearing a mask everywhere you go, that's now also a CDC regulation. The CDC is advising folks to do that. So we have to understand that we know this is uncomfortable. We have to be following the advice of public health professionals at every turn. This could last a few more months. We don't know how we're going to, we have to make it out. We don't know when this is going to be over, but we have to take it seriously. And the more people who are not taking it seriously, who are not practicing social distancing, who are not following and adhering to the advice of the public health professionals, the more people that are going to die, the more people that are going to contract COVID-19. So as I always say, practice social distancing like your life and the lives of the people you care about depend on it, because it actually does. Thank you. Let's see. And again, second question, when will the stay-at-home order be over? The reality is we don't know yet, right? We are now at the point where we are the spot, right? We are one of the hot spots, and we have to understand that 21215 in Baltimore City has the most cases. So understand that this is real, right? This is real, and we have to take this very seriously so that we can keep people healthy and alive. And I want everyone to hear me on that. Like I said earlier, that's why I don't have a haircut. That's why I'm shaping myself up. That's why I can't, my parents live in 215. My grandma lives in 21215. Most of my family still lives there, and I'm preaching to them the same way that I'm preaching to y'all, because I want them to be alive. This is not a game. This is not a joke. All right. Any other questions, everyone? So I see a great question about the long-term vision for reopening the city. It seems like this will be the new normal until there's a vaccine or more testing capabilities. That is a great question. I actually, earlier today, you might find this on the news tonight, asked a similar question of our health professionals in our agency here in the city. How we're going to expand testing in areas, especially those that we know have been the hardest hit. How are we going to push forward and make sure that education is happening in those neighborhoods? How are we going to make sure that we are targeting and tracing down cases? Those are the things that we're going to be discussing and asking of them once the health department and agencies come back to the city council to update us. Let's see. So yeah, earlier today I did say earlier today Rec and Parks went and took down the playground equipment because we still have people taking their children out to use the playgrounds. You know, last month I led the way in asking for us to take down the basketball goals because they put you more at risk. And we were hoping that people would not want to put their children at risk, but they were still happening. And we heard some folks today say, well, why don't we just spray it down and clean it down every day? But the reality is that we are not going to be able to wipe it down after every use, right? And unless you're doing that, there's no way. And even then, it's no way that you're going to stop making places like that, like a petri dish, a breeding ground for COVID-19. So this is why we had to do that. So great question from one of our students. Will we have to repeat the same grade? We don't know yet. Hopefully not. We think that they're going to figure out the ways for the digital learning for you guys to be able to press on to the next grade. We know that it feels unfair, especially for those graduating seniors, to not experience the many things that they have. I had some young people who I used to coach who didn't have their senior finishing their senior basketball season. They didn't have a senior baseball season or anything like that. And we truly feel for all of our young people and all of our students. But we also want to make sure that they move forward on to the next grade. And sorry, Ebony, I'm sorry that you tested positive. I hope and pray that you continue to feel better. If you want us to do deeper follow up for you, please send us a message so that we can do that. And I'm glad that you're still with us, but we want you to be as healthy as possible. And I'm asking everyone on here to lift you up in prayer because we have to do that. And thank you for your work as a healthcare worker, for risking yourself. And we greatly hope and pray that you're able to feel better. And someone said they work in the automotive industry, and the company said that they don't want you to wear masks. You should send us a direct message so we can follow up on that as well. So someone said they've been working in a restaurant for 20 years and just found out they're essential. How are we allowing restaurants to slide through the loophole? They're not sliding through the loophole. They can only be open to do carry out or the delivery, the methods. They are essential businesses right now. All right. Any other question? Someone asked a question about spraying down the streets and sidewalks and buildings. That's something that we've seen in other countries. We have not seen that here in the United States as of yet. And again, all that kind of stuff has to be done with the advice of public health professionals following their advice. Any other questions for anybody? Oh, yes. The individual asking us about Meals on Wheels, we can definitely give you a connection to Meals on Wheels for you to donate to them. Thank you so much for doing that. That's a great cause for us to support. And the last couple things I want to talk to everyone about is just real simply just reiterating some of the stuff. We know that we have a testing site at Pimlico. Still, tests are only given out with the advice of a doctor with a doctor's note. So if you have your doctor, you're feeling bad with the severe symptoms, call them. They will guide you to that. That's how that will be set up. If you don't have a primary care physician, 211 is still a place for you to go, and then they will guide you through that as well. And also just a reminder from the CDC, I know I talked about it a lot already, but whenever possible, everyone, when you're out, wear masks, wear gloves, so that we can keep you safe and keep you healthy. The thing that I want most in Baltimore is that I want Baltimoreans to stay alive. I want us to stay alive from the ongoing epidemic of gun violence in our city. I want us to stay alive from this global health pandemic of COVID-19. And together we can do that if we take this very seriously and we adhere to the advice of the public health professionals. And I also want to say thank you, everyone. Thank you, who's giving support out to Ebony right now. That is the best thing about Baltimore. When people come for us, like we come together. So thank you for supporting her. I want to thank everyone for joining us again. And we will see you again live tomorrow. If you have further questions, just shoot them to us. Thank you for joining us today, and we'll see you again tomorrow. Thank you. Peace.